Myself Adarsh Nitam, rule number 5, and I am going to tell you about pharmacodynamics. Pharmacodynamics. It covers all aspects relating to what the drug does to the body. It is the study of drugs, their mechanism of action, pharmacological actions, and adverse effects. This topic is divided into three subheadings. First, types of drug action. Second, mechanism of drug action. Third, receptor families. Types of drug action. First, stimulation. Some drugs act by increasing the activity of specific organ system. Example, adrenaline stimulates the heart, resulting in an increase in the heart rate and force of contraction. Second, depression. Some drugs act by decreasing the activity of specific organ system. Example, alcohol, barbiturates, general anesthetics, etc. depress the central nervous system. Third, irritation. Certain agents on topical application can cause irritation of the skin and adjacent tissues. When an agent on application to the skin relieves deep-seated pain, it is known as counter-irritant. Example, eucalyptus oil, methyl salicylate, etc. They are useful in sprains, joint pain, and myalgia. They exert their action by reflexly increasing local circulation in deeper structures, blocking impulse conduction in the spinal cord. Fourth, replacement. When there is a deficiency of endogenous substances, they can be replaced by drugs. Example, insulin in diabetes mellitus, thyroxine in rheumatism and myxedema, etc. Fifth, cytotoxic. Drugs are selectively toxic for the infecting organism, cancer cells. Example, antibiotics, anti-cancer drugs. Mechanism of drug action. Mechanism of action of drugs. It is of two types, by non-receptor mediated, second receptor mediated. Non-receptor mediated mechanism of drug action. First, by physical action. A. Osmosis. Some drugs act by exerting an osmotic effect. Example, 20% mannitol in cerebral edema and acute congestive glaucoma. B. Adsorption. Activated charcoal absorbs toxins, hence it is used in the treatment of drug poisoning. C. Demulcent. Cough syrup produces a soothing effect in pharyngitis by coating the inflamed mucosa. D. Radioactivity. Radioactive isotopes emit rays and destroy the tissue. Example, isotope of iodine in hyperthyroidism. Second, by chemical actions. A. Antacids are weak bases. They neutralize gastric acid, useful in peptic ulcer. B. Metal like iron, copper, mercury, etc. are eliminated from the body with the help of chelating agents. These agents trap metals and form water-soluble complexes, which are rapidly excreted from the body. Example, dimercaprol, BAL in arsenic poisoning, desferoxamine in iron poisoning, and D-penicillamine in copper poisoning. Third, through enzymes. Some drugs act by inhibiting the enzyme activity. A. Drug action via enzyme inhibition. First, angiotensin converting enzyme ACE inhibitors such as captopril, enalapril, etc. act by inhibiting ACE. They are used in treatment of hypertension, CHF, etc. Second, xanthine and hypoxanthine are oxidized to uric acid by the enzyme xanthine oxidase, which is inhibited by allopurinol. Allopurinol is used in the treatment of chronic gout to reduce the synthesis of uric acid. Fourth, through ion channels. Some drugs directly bind to ion channels and alter the flow of ions. Example, local anesthetics block sodium channels in neuronal membrane to produce local anesthesia. Fifth, through antibody production. Vaccine produce their effect by stimulating the formation of antibodies. Example, vaccine against tuberculosis, BCG, oral polio vaccine, etc. 6. Transporters. Some drugs produce their effect by binding to transporters. Selective serotonin reuptake inhibitors, SSRIs, bind to 5-HT transporter, block 5-HT reuptake into neurons, antidepressant effect. 7. Others. Anti-cancer drugs like cyclophosphamide produce their effect by binding to nucleic acids. Drugs like colchicine bind to tubulin and prevent migration of neutrophils, hence useful in acute gout. Receptor-mediated mechanism of drug action. Receptors are macromolecules present either on the cell surface, cytoplasm, or in the nucleus with which the drug binds and interacts to produce cellular changes. Drug plus receptor forms drug-receptor complex, give response. For example, adrenergic receptors, alpha and beta, cholinergic receptors, muscarinic and nicotinic, opioid receptors, etc. Affinity. The ability of the drug to get bound to the receptor is known as affinity. Intrinsic activity. The ability of the drug to produce pharmacological action after combining with the receptor is known as intrinsic activity of the drug. Agonist. The drug that is capable of producing pharmacological action after binding to the receptor is called an agonist. Agonist has a high affinity plus high intrinsic activity. Example, morphine and adrenaline. Antagonist. A drug that prevents binding of agonist to its receptor or blocks its effect is called an antagonist. It does not by itself produce any effect. Competitive antagonist has high affinity without intrinsic activity. Example, naloxone and atropine. It produces receptor blockade. Partial agonist. A drug that binds to the receptor but produces an effect less than that of an agonist is called partial agonist. It inhibits the effect of agonist. Partial agonist has affinity plus less intrinsic activity. Example, pindolol and buprenorphine. Inverse agonist. It has full affinity towards the receptor but produces effect opposite to that of an agonist. Example, benzodiazepines produce anti-anxiety and anticonvulsant effects by interacting with benzodiazepine receptors, and beta-carbolines act as inverse agonists at benzodiazepine receptor and produce anxiety and convulsions. Inverse agonist has affinity plus intrinsic activity between 0 and -1. Example, beta-carbolines. Receptor families. First, ligand-gated ion channels, ionotropic receptors. Second, G-protein coupled receptors, metabotropic receptors. Third, enzymatic receptors. Fourth, receptors regulating gene expression, transcription factors, or the nuclear receptor. Characteristics of various receptor families. First, ligand-gated ion channels. Location, membrane. Effector, ion channel. Coupling, direct. Examples, nicotinic GABA A receptors. Time required for response, milliseconds. Second, G-protein coupled receptors. Location, membrane. Effector, channel or enzyme. Coupling, G-protein. GS, GI, GQ, etc. Example, muscarinic adrenergic receptors. Time required for response, seconds. Third, enzymatic receptors. Location, membrane. Effector, enzyme. Coupling, direct. Example, insulin, growth factor, cytokine receptors. Time required for response, minutes to hours. Fourth, nuclear receptors. Location, intracellular. Effector, gene transcription. Coupling, via DNA. Example, steroid, thyroid hormone receptors. Time required for response, hours. Ligand-gated ion channels, ionotropic receptors. Examples are nicotinic N-acetylcholine receptors at neuromuscular junction, GABA and glutamate receptor in the CNS. Binding of the agonist to ionotropic receptors, then open the ion channels, sodium, potassium, calcium, chlorine, then flow of ions through the channels, then hyperpolarization, depolarization, then tissue response. The onset of action of a drug is the fastest through this receptor. G-protein coupled receptors, metabotropic receptors. They are coupled to intracellular effectors through G-proteins. G-proteins are membrane proteins and have 3 subunits, alpha, beta, gamma, with GTP bound to the alpha subunit. G-protein coupled receptors, effector pathways and second messengers. G-protein coupled receptors, GPCRs, are transmembrane receptors which control cell function via adenylyl cyclase, phospholipase C, ion channels, etc. The agonist that binds to the receptor is the first messenger. It results in the generation or recruitment of molecules, second messengers, that initiate the signaling mechanism in a cell. Examples of second messengers are CAMP generated by adenylyl cyclase, CGMP generated by guanylyl cyclase, calcium IP3 DAG generated by phospholipase C, nitric oxide, etc. Binding of agonist to receptors, then coupling of G protein to the receptors, then GDP bound to alpha subunit exchanges with GTP, then dissociation of G protein subunit from occupied receptors, then alpha GTP also dissociate from beta gamma subunit, then alpha GTP and beta gamma subunit are released, then bind to target enzyme ion channel, then stimulate the GTPase associated with alpha subunit, GTP converted into GDP. Alpha subunit associates with beta gamma subunit. Effects produced depends on the type of G protein, G stimulatory, G inhibitory, GQ and G0, which associate with agonist occupied receptor. G stimulatory stimulate adenylyl cyclase, increase CAMP. Example beta adrenergic receptors. G inhibitory inhibits adenylyl cyclase, decrease CAMP. Example alpha 2 adrenergic receptors in smooth muscles. GQ stimulates phospholipase C, increase IP3 and increase DAG. Example muscarinic M1 receptors. Beta gamma stimulate inhibits enzyme and ion channel. Example all GPCRs. Transmembrane enzyme linked receptors. This could be transmembrane enzyme linked receptors. Example receptor tyrosine kinase for insulin, epidermal growth factor, etc. Intracellular part of the receptor has enzymatic activity, intrinsic enzyme activity. Transmembrane receptors. Example receptors of cytokines, growth hormones, etc. have no intrinsic enzymatic activity in their intracellular part. On activation, they bind to cytosolic kinases. Example Janus kinase, JAK. Binding of agonist to extracellular domain of receptors, then dimerization of the receptors, then stimulates intrinsic kinase activity, then activates intracellular signaling pathways, then gene transcription, then tissue response. Nuclear receptors regulate gene expression. Examples receptors for thyroxine, vitamin A and D, sex steroids and glucocorticoids. Regulation of receptors. Receptors can be regulated by various mechanisms resulting in either their upregulation or downregulation. In receptor downregulation, prolonged use of agonist decrease receptor number and sensitivity, decrease drug effect. For example, chronic use of salbutamol downregulates the beta-2 adrenoceptors, which may be responsible for decreased effect of salbutamol in asthmatics. In receptor upregulation, prolonged use of antagonist increased receptor number and sensitivity on sudden stoppage of antagonist, increased response to agonist. For example, when propranolol is stopped after prolonged use, some patients experience withdrawal symptoms such as nervousness, anxiety, palpitation, tachycardia, rise in BP, increased incidence of angina, or even myocardial infarction may be precipitated. This is due to upregulation or supersensitivity of beta adrenoceptors to catecholamines. Therefore, propranolol should not be discontinued abruptly.